I'm Brandon McCafferty. I'm an ophthalmologist for the Vision Center here at the Great Falls Hospital. So an optometrist is somebody who goes to optometry school. It's typically a 3 or 4 year program. Mainly learn how to do eye exams and prescribe glasses, prescribe contact lenses. An ophthalmologist goes to medical school, then completes a residency in ophthalmology. Ophthalmologists can treat more medical conditions, can do surgical procedures that optometrists can't. So what is a cataract? Cataract just means that the lens that we're born with, which sits right behind our pupil, is starting to get cloudy. Typically, it's an age-related change that happens just due to some protein changes with the lens over time. What symptoms should people watch for with cataract? So the first thing people typically notice is difficulty at night. Difficulty with night driving, glare, halos, starbursts around headlights or streetlights are very common symptoms, blurry vision in general, and then sometimes needing more light to see, more light to read, those types of things. So do cataracts just affect older adults, or can younger people get them too? So typically cataracts are age-related. They do come on later in life for most people, but they can be genetic. Children can be born with cataracts and have to have cataract surgery in the first few weeks or first few months of life. That's less common. And sometimes young adults can also get cataracts due to certain medical conditions or medications or smoking or diet. So can cataracts be prevented or slowed down, or are they just inevitable? I consider cataracts a part of life. If you live long enough, eventually you will get a cataract. But they can be slowed down. You can prevent early onset of cataract by certain lifestyle changes, avoiding smoking, wearing sunglasses to protect your eyes from the sun, limiting certain medication use, like steroids are a big one, and then following a healthy diet. And then certain medical conditions can also lead to cataract, like diabetes, so keeping blood sugars under good control is another one. So when is cataract surgery recommended? That's a difficult question to answer. My approach typically is to kind of let the patient decide when they're ready. Typically when they feel that their quality of life is diminished, or they can't do their typical activities of daily living or driving or reading comfortably. The only time I'll kind of give somebody the nudge to say they really should do surgery is if I think they're waiting too long. Eventually the surgery can become more risky if you wait too long. So what does cataract surgery actually entail? So with cataract surgery, we're removing the cloudy lens, typically using ultrasound, and then replacing it with a lens implant made out of plastic that we put inside the eye. And that lens implant has power, much like a glasses lens or a contact lens does. And these are what the lens implants will look like when they're inside the eye. So what do I think the keys are for healthy vision? I think the biggest ones are lifestyle modifications that you can do. So eating a healthy diet, wearing sunglasses to protect your eyes from the sun, avoiding smoking, and following up with your primary care doctor to treat any other medical conditions you may have. A lot of other conditions affect vision or can affect the eyes. And so just preventive care is always best.